CBS 2 is breaking the stigma when it comes to children and mental health. And this morning we have some heartbreaking numbers to share with you, as well as a message of hope. According to the CDC, 42% of high school students across the U.S. experience persistent feelings of sadness or hopelessness in the 12 months prior to a survey in 2021. In that same year, 22% seriously considered attempting suicide and 10% attempted suicide. Here's a closer look at the numbers in our area. From a survey in 2019, 35% of high school students in New York and 36% in New Jersey experienced persistent feelings of sadness or hopelessness. In that same year, 17% of high school students in New York and 15% in New Jersey seriously considered attempting suicide, while 9% in New York and 6% in New Jersey attempted suicide. But there are steps schools can take to turn these numbers around. The CDC offers free evidence-based guidance through its Healthy Schools program. It's all on the CDC Healthy Schools website. There's information for state, district, school leaders, teachers, and staff, as well as for students and their families. And to break it all down, joining me now is Dr. Sarah Lee, one of the team members behind CDC's Healthy Schools program. Good morning, and thank you so much for being here.
Good morning. Thank you so much for having me.
Doctor, the numbers we showed are just so eye-opening. What are you finding when you look at the data?
It is very eye-opening, and we see that our kids are struggling. And the data tell us that we are absolutely in the middle of a youth mental health crisis. And you mentioned schools, and they play a big role in addressing this crisis. They can be and are part of the solution. We know that schools show up to the school building with challenges, and that can be buffered by creating healthy and supportive school environments.
Let's talk about the CDC's Healthy Schools program. How does the work you do help schools support the mental health of the students?
Sure. So we use what is called the whole school, whole community, whole child approach. And this is really a comprehensive approach that focuses on creating those supportive and healthy environments that provides opportunities for students to learn and practice healthy behaviors. And here are a few examples that schools can do to adopt and implement this approach. Things such as greeting all students as they enter the building, and letting students know they have caring adults within the school, as well as including lessons about emotional well-being and mental health into the school curriculum. Things like providing direct mental health services within the school. And then the last thing I wanted to highlight that we promote within this approach is promoting and providing regular opportunities for healthy behaviors, such as physical activity and healthy eating. Particularly those two behaviors, because they have been shown to be really important in improving students' mental health and minimizing the effects of being anxious, stressed, or depressed.
Your approach focuses on proving healthy behaviors to improve mental health. In addition to some of those specific examples that you have, how do you get the parents involved?
Yes, this is a great question. And as I said, it's one of those things where we don't want to put all that pressure on schools and have schools bear the weight and total responsibility. They are not alone in addressing this crisis. And that's really what that whole school, whole community, whole child approach takes into account. And it's really looking at the connection across the school, the family, and the community. The more that those connections are made, the better. So for example, let's talk about what schools can do to engage these other sectors. First, they can ask parents and children, what are their mental health and well-being needs? Got to start with those who you're serving. Second is to be able to provide information to parents about what exists in the community. What community-based resources are there for mental health? What programs exist for wellness and well-being? And then finally, share and promote the ways in which schools are creating those healthy and supportive environments for their children.
Doctor, thank you so much for being here and for all the work that you and your team do.
Thank you.
For more information on the CDC's Healthy Schools program, we've set up a link on cbsnewyork.com. And if you or someone you know is in need of mental health support, there's help available 24 hours a day, 7 days a week. Call 988 for the Suicide and Crisis Lifeline. Also, later today, we're dedicating an entire half hour to breaking the stigma surrounding children and mental health. We'll hear directly from young children and teenagers about their struggles and talk about the different resources available to them. We'll cover all that and more on our half-hour special, Breaking the Stigma, Children and Mental Health, on CBS 2 at 5:30.